Thank you for being here, first of all. This is an effort today for organized medicine to start engaging in a conversation about what we think is a very important part of health system reform. As you may know, Congress recently passed a comprehensive bill to reform our healthcare system. One of the issues that was painfully left out of that reform effort was a fix for the so-called SGR, the Sustainable Growth Rate formula, under which physicians are compensated for seeing Medicare patients. This issue is about access to care for our patients. That, as you will see when I introduce the rest of the members here, that this issue is something that we have decided it's time to engage our patients at a grassroots level to get involved in helping us fix a system that desperately needs to be fixed. We're joining in an effort in all 50 state medical associations around the country and their component medical societies. In Oklahoma, we have 43 county medical societies that are joining with us in this petition drive. And I'm going to let you hear from the panelists. We have representatives from the Tulsa County Medical Society, the Oklahoma County Medical Society, and the rural section that represents all of the other county medical societies in Oklahoma. With that, I'm going to introduce who's here today: Dr. Woody Jenkins from Stillwater, Dr. Mary Clark from Stillwater. Behind me here is Dr. Kay Mehta, who's president of OSMA, Dr. Larry Bookman from Oklahoma County Medical Society, and Dr. Harris from the Tulsa County Medical Society. And we also brought a patient along with us too, so you can see that we are trying to make this a collaborative effort with our patients. With that, I'm going to ask Dr. Mehta to step forward and say a few words.
Good morning. I'm Dr. Kay Mehta. I'm the president of the Oklahoma State Medical Association. I'm a vascular surgeon here in Oklahoma City. The SGR formula, which was introduced about 10 years ago, which relates to how the physicians are being reimbursed throughout the country under the Medicare and subsequently also under Medicaid and TRICARE, because the Medicaid and TRICARE reimbursements are closely tied to Medicare reimbursement. And the reimbursement rates, when they decide to introduce the SGR formula, is not really related to the work that we do. It is related to the amount of money they have available to pay. And it doesn't matter how much work we do. If the money is not available, our reimbursement goes down. And that's exactly has been happening. And the Congress for the last 6 years have been just providing a little Band-Aid treatment of just postponing those cuts, which are now resulted into about 21% cut that is going to be introduced if the Congress does not act. And this is causing a lot of problem for the physicians all over the country. Because of the reducing reimbursement, they are not able to see the Medicare, Medicaid, and TRICARE patients. So that reduces the availability of physicians and the access to care for these patients who need the physicians the most. And I'll see, this chart is in your packet here that shows what has happened to the cost of practicing medicine. As the inflation has gone up, in 2010, compared to 2001, the cost has gone up by 25%, while our reimbursement has not gone up one bit. So we are already working with about 20% disadvantage, 25% disadvantage. If the reimbursement goes down further by another 20%, we'll be working with a 45% disadvantage compared to the cost of living. And that makes it very difficult for physicians to keep their offices open. We don't only have to provide for the cost of what we do in our offices, we need to live our lives too. We need to take some money home so we can pay our own mortgages. And when the physicians can't do that and it actually costs them to take care of the patient, then they'll have to stop taking care of the patients. Many physicians have already started dropping out of Medicare system because of that. And that's why we are starting this grassroots efforts to have 1 million patients sign up against the cut in the reimbursement. So Congress really needs to listen to all the physicians and their patients and act on it. Thank Thank you very much.
Doctor, would you spell your last name?
Mehta.
Thank you.
I'm Larry Bookman, and I'm a gastroenterologist here in Oklahoma City with digestive disease specialist. And as a specialist here in Oklahoma, I just want to emphasize that this is much more than a monetary problem. This is an access to care problem. Medicare patients, our soldiers, and all of our federally insured patients are going to have a very difficult time, as Medicare patients have already found out, as primary care physicians throughout the state have begun to stop seeing new Medicare patients, limit the number of Medicare patients, and especially in the rural areas where we already have a shortage of primary care, to then limit Medicare is going to make it very difficult for those patients to access care. From a specialist standpoint, specialties throughout the Oklahoma City area have begun discussing limiting access to care for Medicare patients. So we urge the press, the patients to get involved. Physicians, through our organizations, have tried for years to get Congress to understand they're only going to listen to a populist voice. The million signatures that we're trying to obtain across the United States, we hope will have their attention and get them to act, which they have not done in the last decade.
Dr. Jenkins, would you like to?
I'm Woody Jenkins. I'm a primary care physician in rural Oklahoma and represent the rural section. Primary care in the rural of Oklahoma is down. We don't have enough physicians to take care of the patients already. If this cut were to go through, then access to care, my Medicare patients are going to have harder and harder time not only to see primary care, but also the specialists in our community. As I've said, you know, when you have fixed overhead and you don't get reimbursement to cover that overhead to see the patient, you're going to limit those patients. And I've already done that in my practice the last couple of years, and I know that our community is going to be down physicians if this goes through. I urge you to help support our campaign in getting 1 million signatures across the country and in Oklahoma to help get Congress's attention. Thank you.
Doctor, where exactly is your clinic?
Yeah. Warren Clinic in Stillwater.
Dr. Clark, would you like to?
I'm Mary Clark. I'm a primary care family physician in Stillwater. I actually work with Dr. Jenkins at the Warren Clinic. And I've been with the Warren Clinic just under 2 years now. And in 2 years, I've just recently limited my Medicare practice because of the cuts that we've had and the looming 21% cut. If things change, I will, of course, reconsider that. But I'm one of the new rural physicians who moved into a rural area because that's what I wanted to do. But as it stands, I won't be able to continue to see Medicare patients and, of course, the TRICARE and some of the Medicaid because of this issue. And that's really disturbing because all of us here today and every physician across the country, we do this because we love it. We enjoy the job. Otherwise, we'd be doing something else. And it's very disturbing to us that we aren't going to be able to do this because of some of the forced economic troubles that have been going on in the country. And I urge, just as Dr. Jenkins and everyone else here, to work with our patients to help with this petition drive and help fix the SGR finally, so that as we go forward, we are able to bring more physicians into the area, into medicine, and into all the areas that really need our physicians, primary care and specialty. Thank you.
Dr. Harris?